This is the special broadcast coverage of the coronavirus crisis using the combined forces of TV5 and Signal TV's One News, Radio 5 and 1PH. Also joining us on occasion will be our One News partners from the Philippine Star and Business World. There are now 187 confirmed cases of COVID-19 in the country, with 45 new cases reported today. The Health Department in its bulletin today also said that there is one more case who has recovered, bringing the total number of recovered to 4. The DOH also confirmed that community transmission of COVID-19 in the Philippines has already happened. Community transmission is declared when a person diagnosed with the disease, despite not having been to a high-risk area and having no contact with any other confirmed cases. And to give us a better understanding of the COVID-19 situation in the country, we have on the line an epidemiologist expert, Dr. Troy Hepte. Good afternoon, sir.
Good afternoon, Ed.
Hi, Dr. Troy.
Good afternoon to our viewers.
Yes, sir. By the way, Dr. Troy was also the author or the one who wrote the Philippine pandemic plan in, was it 2012?
Yes, partially, Ed. We tried to contribute to the present DOH approach or strategy for handling these emerging infectious diseases. So it's a group of diseases which we were preparing for, and it just so happened that COVID-19 is what we got here now in 2020.
Yes, sir. Yeah. And just so our viewers know, Dr. Troy Hepte is also recognized as the country's best epidemiologist, if I understand correctly.
That's too kind, Ed, but I'm just helping out with any way I can para sa bayan natin. So, ano lang tayo talaga, tutulong-tulong lang talaga.
Well, Dr. Troy, your colleagues were the one who described you as such, so they're in the best position to say so. Well, now, Dr. Troy, if you may tell us more about this community transmission and its implications. What we understand of community transmission is that it is a local transmission on a bigger scale. Is that correct?
Yeah, that's right. What we were really watching out for is like what happened in other countries where we have the COVID-19 epidemic in their own localities, is that when we have cases that are occurring without really attributing them to any travel abroad, that's when we really have a good sense where cases are occurring as they are being infected by their own members of the community. So talagang ano na tayo ngayon, yung this is what we were expecting na talagang mangyayari. And we are just hoping that what we have now, the community quarantine, the enhanced community quarantine, will be just enough. There's a timing natin so that we can try to decrease yung number of cases para hindi talaga dumami masyado yung pumupunta sa mga hospitals at sa mga health centers and clinics natin. What we are trying to do now with our enhanced community quarantine is to, I think a lot of you have maybe seen yung meme or yung hashtag of flattening the curve, where we have a big jump of cases. That's what we're trying to avoid. Like what happened sa South Korea, sa Iran, and specifically now sa Italy, where they are really experiencing still steady rise of their cases.
But doctor, exactly when does a country declare that it has community transmission? I mean, when is the cutoff, or when is the trigger when local transmission becomes community transmission? Is there a number there?
No, actually, it's just really more of how we will depend on our own surveillance. When we actually see a growing number of cases where there is no attribution to anyone who might have traveled abroad, that's when we surmise, that's when we presume that local transmission has already occurred. And when there are more and more cases, that's where we have sustained local transmission.
Doctor, I think today the DOH says that it had confirmed 45 new cases. Isn't that the biggest number of cases confirmed in just one day?
I'm not sure, Ed, but it's really a big jump. Other countries have it harder. I know that in Italy and in France, they have like new cases per day in the hundreds. So it's really something that's maybe really making us worry. But at the same time, we have to be guided by how the numbers have been doubling in other countries. So we are expecting that maybe we have an increase of the number of cases, and when it doubles, it's like maybe a week. So if we sustain that kind of pattern or trend, then our healthcare system will really be affected, and that's what we're trying to avoid now with our enhanced community quarantine.
Yes, Doc. Now, Doc, if we did not undergo quarantine, if we did not undertake the measures that we have, based on on your projections, based on the projections of the DOH and possibly all the other experts, how bad could it have been? What numbers could we be hitting if we do not undertake quarantine?
The worst case scenario might be that in a few days to a few weeks, we might have a lot of cases going to the hundreds, maybe 700 or more. And later on, we might have reached yung 1,000 case na barrier. So it's something touch and go for the meantime. So we just have to see how it will affect our transmission in the communities. What's important right now is for us to remember that it's Metro Manila, and actually there are cities in Metro Manila where there is intense transmission now. So that's what we are trying to guard. And every chance we get, if we put people at home, in home, where they are safe, where they have relatively less chance of spreading the disease to others, then that's better. That's the best thing we can do right now. Yeah.
Doctor, if I may I ask you if you've been able to go around today, or are you quarantined at home?
Actually, I've been meeting with some doctors and also some public health specialists or experts. We mostly conduct this online, but I also try to get involved with anything that could help our government. So I try to also attend meetings with the DOH or maybe with the task force. But what I've seen is that they have checkpoints in place along the road here in Quezon City. They have some checkpoints, and the people are in their homes. There's a few motorcycles and vans, and I see a lot of ambulances, definitely, and the police presence is notable. So it's very clear that we are very serious about how we will implement this community quarantine.
Yes, doctor. Well, the reason I asked the reason I asked if you've been able to go around is I wanted to ask you your assessment as to how the quarantine is being implemented. You did mention that you have seen a few people out there and perhaps a few motorcycles, but in general, do you think that we're doing a good job with the quarantine, or should we be doing better?
I think Ed, we still have a lot of things to do to improve. So from what we've seen from the past few days, since we had the first community quarantine declaration by the president in his proclamation, we've tried to make people distance themselves from each other. The problem with our checkpoints was that instead of committing ourselves to social distancing, we actually enhanced people to come closer together because of how everything was congested during the checkpoint setup. And another thing is that when you go around, you might see some of the our senior citizens who are still outside. So we just like to remind people that they are the ones who are really most affected by this disease, because those who may come down with COVID-19, a lot of the complications might set in for those who are in their senior years. And also for those who have comorbidities or diseases that are chronic in nature, like hypertension, diabetes, those with renal diseases, or those with bad or depressed immune systems. So we need to call out people for trying to enforce better our community quarantine.
Well, doctor, our reporters have been covering those border checkpoints that seem seem to be pretty crowded. For example, Muntinlupa area and Las
Yes.
Piñas area, and the persistent argument that many people who are still out are still using is that well, they have to make a living and they have to earn a daily wage. So it's a bit difficult for, I suppose, people to strike that balance between what we would call social distancing and perhaps in their case social realities of trying to make a living.
Yes. As you said, it's really striking a balance between the two things, our health and our livelihood, our economy. And as we are trying to make this more clear day by day, our task force and our agencies of the government are really trying to tease out all the details of how we could provide more for our citizens, for our countrymen. And it's really something that's unprecedented. Again, I might say that this is the first time that we're going to do this, and it's going to be for the long haul. So this will take a month, maybe two, at the most three, I guess. And we need to take care of our citizens with regards to what they can eat, how they will provide for their families, and such. So it's really something that, if I may say, parang wala talaga tayong right or wrong decision dito eh. It's just trying to make the best decisions as we go along, since this is really our very first time to experience such an event like COVID-19.
Well, Dr. Troy Hepte, thank you for joining us. Dr. Troy Hepte, the top epidemiologist of the country. We hope to be able to call you again as soon as we have any updates. Thank you, sir. Baliuag, Bulacan Mayor Ferdi Estrella has tested positive for COVID-19. Estrella says that his symptoms manifested last week. Meanwhile, presidential son and Davao City Vice Mayor Sebastian Duterte is reportedly undergoing self-quarantine as a person under monitoring for COVID-19. According to reports, Baste has flu-like symptoms including cough, fever, and sore throat. Meanwhile, BDO confirms that an employee in one of its branches in San Juan City tested positive for the virus. The bank says it is closely monitoring the patient's situation as it also ensures the well-being of its employees, customers, and its suppliers. The country's interagency task force on COVID-19 has approved a window time for passengers. The IATF says all passengers, regardless of nationality, may depart from the country within the 72-hour period unless their flights have been canceled by their respective airlines or the Civil Aeronautics Board. All Cebu Pacific and Cebgo flights will be canceled from March 19 until April 14. Air Asia, meanwhile, has halted all its domestic flights to and from the Ninoy Aquino International Airport and Clark International Airport until April 14. The Labor Department has rolled out its COVID-19 adjustment program worth 1.3 billion pesos. Affected workers of small and micro enterprises will receive a 5,000 peso financial aid through their payroll system. DOLE adds that informal sector workers and those who have been displaced may avail of its TUPAD program for financial assistance.
Doon sila mag-register at saka doon nila ilagay yung mga pangalan ng mga empleyado nilang naapektuhan. Karamihan ito ang magsasubmit HR. But this is subject to validation.
With businesses also taking a hit from the COVID-19 crisis, how is the private sector responding to the virus scare? And to discuss that, we have on the line Joey Concepcion, President and CEO of RFM Corporation, and also the Presidential Advisor for Entrepreneurship. Good afternoon, sir, and thank you for joining us.
Good afternoon.
Yes, sir. Well, as you probably heard last night, sir, the President specifically called on the private sector and big business to help in the response to COVID-19, specifically in terms of helping out employees who may be affected by the crisis. Sir, can you give us a briefer on exactly what is big industry doing about this?
Well, actually, it's not just employees. Also our micro and small entrepreneurs that will be greatly affected. As an advisor to the President on entrepreneurship, this poses the greatest challenge to our country, actually. If you look at it, it's really balancing the economy and the virus. How does the people in government really look moving forward on how to balance this, no? Whereby we get rid of the virus but not damage the economy,
Yes, sir.
and vice versa. So I think that is the principle that the cabinet is trying to work, and I think the president made the right decision in the last 2 days to really going very aggressive, because the virus is also going very aggressive. So the private sector, as we speak, since this morning, we've been basically on the phone talking to the business organizations, the different conglomerates, and for sure, all of us, big business, are going to step up, because the very fiber of our economy is our micro and small entrepreneurs,
Yes,
plus the employees that we have. And we have not seen anything like this. And if I look at it, it's something like a perfect storm. So if the economy starts to go and does a tailspin and the virus goes uncontrolled, then you have a situation that will be pretty dangerous. So what we have been doing is trying to align with the cabinet on the programs. In other words, it's very important is the food supply and the
Yes, sir.
medicine to be continuing. So the production facilities of all food companies, be it that supply all the groceries, supermarkets, convenience stores, and especially the sari-sari stores and the wet market must not stop. That's very basic, no? Of course, the critical companies as well. So this is what we're trying to ensure. Now, we will operate with very lean staff. Most of the offices will operate with hardly anybody. But what's important to us is that the supply chain from the production to the delivery to the outlets and going back is fulfilled in a seamless. And well, today it was a bit messy because there were a lot of birthing pains
Yes,
in
sir.
this whole process. So hopefully in the coming days it will improve. Of course, also these companies need their raw materials. So that supply chain that goes all the way to the food companies and the pharma and all of that has to happen, no, without any impediment.
Yes,
The
sir.
challenges that we face is that while Luzon technically is on a, what do you call this, a community quarantine,
Lockdown. Yes, sir.
or lockdown, what you can say, there are some provinces that are also doing their lockdown, which poses a problem because some of the trucks are not able to go through, many other issues. So, and employees cannot move from one point to the other. So that is another problem. And my proposal to Secretary Anyo was hopefully that since we are already on a lockdown on Luzon, maybe the provinces can focus on the barangay levels where they lock down barangays that have the virus there, no, and not lock the entire province, no, because technically the entire Luzon is in the quarantine or a lockdown already.
Yes, sir. Sir, let me see if I'm getting this right. What you are proposing, or what you have proposed to Secretary Anyo already, is because since Luzon is already on lockdown, then you may have other different levels of lockdowns in non-affected barangays or towns. In other words, maaring mas maluwag doon sa ilang lugar kung saan, for example, wala pang may sakit, mas maigpit naman doon sa mga lugar na meron ng sakit.
Oh, dapat yung mga barangay captain, as the President said last night, the barangay captain plays a very important role here, whereby they protect their respective areas, no, and that's where the virus starts. No? So in areas that are threatened, they can lock it down. But wag naman yung buong area kasi naka-lockdown na ang buong Luzon.
Parang
So,
wag total lockdown lahat ng Luzon.
Yeah. Well, technically, it's already locked down. And
Yes, sir.
If each province will also have it locked down with their own rules, then medyo magulo. So hopefully, this is part of the birthing pains na it can be sorted out. And I think in the IATF today, they're sorting out the PSE will open tomorrow, which is a good news. We have told Secretary Mon Lopez, the other manufacturing companies, the semiconductor companies which has obligations, and many others are also hampered because they have employees and they have commitments. So a proposal that I have made is that maybe manufacturing companies that want to operate must provide their own shuttle for the employees,
Yes,
and
sir.
maybe even provide their own housing, their own lodging to provide them, so that from basically what they move is from factory to their place of in facility, whether it's in the factory or outside of the factory, and the transportation is provided by the private sector.
Yes,
so
sir.
if more the private sector would embrace this and government would accept that, then maybe more manufacturing plants can run and people will be employed and they can get paid their salary. As right now, they're basically on leave, leave with pay definitely for the next 15 days. Some have maybe a COVID leave, some have no COVID leave. It depends on the company. So I think we can find a win-win solution whereby public transportation still is on hold, but private sector takes over whose transportation for their employees so that they can work in the different factories.
Yes, sir. Sir, one more question, if I may. Speaking about entrepreneurs, I would suppose that they're probably one of the harder hit sectors. I mean, they are facing a conundrum. On one hand, they're probably not having any income for the next month. On the other hand, they have to think about the benefits for their employees and how to help them out and so on down the line. How do you do that balancing act? Not having not having an income and then having to worry about your employees.
Well, if big business is challenged at this point in time, some of the conglomerates, airlines, retail is badly hit. All the malls are closed, all the restaurants are closed. It's a bitter pill that we all have to swallow just to prevent this virus from really getting out of control. And we have to now just brace ourselves. Now, in the end, our micro and small entrepreneurs, well, fortunately, many of our micro entrepreneurs are in retail, have small carinderias. So somehow, food is very strong because people are eating eating at home. So they could get the supply from the carinderias, the sari-sari stores. We have over 1.4 million sari-sari stores. So that's somehow insulated because the demand for food is high. The demand in the carinderias are, I'm sure, high. The palenques are the same. So, but in the end, there are other MSMEs that are hit who are not in the sector, in other areas, in tourism, in
Yes,
other forms. So, but in the end, I think we just have to brace ourselves. And I've been talking to a number of the MSMEs that hopefully the landlords will be kind enough to look at, and I'm sure that the rent will be waived if the mall is closed.
Yes,
obviously.
sir. Sana, sir.
So most of that's sure, because of course the mall is closed, then why will they have to pay a rent? So again, we hope that the banks or the MFIs will be able to provide some leeway in the financing terms, and I'm sure they will in this stressful environment.
Okay. Maraming salamat po, Presidential Advisor for Entrepreneurship, Joey Concepcion. Thank you, sir, for joining us. That's the latest on the enhanced and expanded community quarantine in Luzon. For more updates, follow News 5, The Philippine Star, and Business World Online. I'm Ed Lingao. We are One News.